So my name is Dr. Tom Roberts. I've been a dentist in Seattle since 1983. I'm a local guy. People ask me how prevalent this is. There's thousands of people that have sleep apnea that don't know they have sleep apnea. I mean, I've seen people with severe sleep apnea that didn't know they had it. And that's amazing to me. And I have literally had people who had such severe sleep apnea that they were literally dying in bed.
My wife continually couldn't sleep and was constantly waking me up as she said I was snoring. But of course I didn't believe her. I always thought I was tired just from the nature of my job and my crazy sleep schedule. Once the results came in, I was pretty surprised that it did show that I had sleep apnea.
I had been a patient of Dr. Roberts probably since maybe 97. I guess we were talking one time during one of my visits and I mentioned that I had sleep apnea and he said, I do too. And I said, I have mild sleep apnea. He said, I do too. I have mild sleep apnea. And I said, well, what do you do? And he said, well, I use a dental device. And I said, no way. And he started describing it to me. And I'll never forget the first thing I asked him. I said, how did you get one of those things? Because he showed me sort of like a model in his office. And he said, I'm a dentist.
I get a lot of people who come in who are on CPAP machines and don't realize there's an alternative. There's less education being put out there about the dental device, and the dental device is a really good alternative, especially for people with mild to moderate sleep apnea. This apparatus is cumbersome. The dental device helps maintain the airway by holding the jaw forward. For me, this was the most comfortable of all of them. This is called a dorsal fin device for obvious reasons, but it's two separate devices. You can open and close your mouth, you can drink water if you need to, and it's life-changing. It has been life-changing for my patients.
Once I heard about this from Dr. Roberts, it was a no-brainer for me. It was a real eye-opener when I did start waking up an hour, half hour to an hour ahead of my alarm every day and actually being awake rather than just stumbling out of bed and feeling like I needed a cup of coffee to wake up.
Most people find that they can tolerate this quite well. Obviously, this is a lot simpler than a CPAP machine and can work as well as a CPAP machine or better because people are more willing to wear these oftentimes.
The moment I got it back, popped it in, I have only slept one night without it, and that's because I fell asleep before I could remember to put it in my mouth. I told him that this thing is my best friend, and it's probably my husband's best friend too.
It's so comfortable and so easy to put in and take out, and allows you to breathe just fine, even with a head cold or anything. Haven't had any issues with it at all.
For myself, it took me a few weeks to get used to having all that in my mouth and having the position, but now I don't even know it's there. Once I'm asleep, I'm asleep, and it doesn't bother me at all.
It's really not that obtrusive, and it's certainly way less obtrusive than that machine. I mean, I would wait until the lights go out before I strap that puppy on. And when I travel, I just take this with me. I never used to travel with the CPAP machine. No way.
It's fantastic being a dentist. We do amazing things to help people save their teeth and to look better. But when you have somebody come back and say, I slept for the first time in years, I actually slept through the night, something really magical about that. It feels really good to do that.
Being tired a lot during the day is a big one. Everybody's like, oh, it's just afternoon sleepies. For me, I'm like, it doesn't seem exactly normal. That's when I had kids. My wife had kids, I thought, oh, maybe it's just kids. But then my wife was saying, no, your snoring's gotten worse, so maybe it's sleep apnea.
I don't have any problem at all telling people how much it changed my life. But the fact now that my wife and my son don't have to shut the door or go into another room to sleep, and they're actually able to sleep better throughout the night is actually more important for me. It affects not just me, but it affects my family in a much more positive way.
I've missed one night, and that might be as many nights as I would have used a CPAP in a year. And the quality's great, and it's convenient. Why would I use anything else? I would just highly recommend this particular device and really recommend Dr. Roberts too.
So I think the important thing is if you even think there's a possibility give us a call and we can at least get you pointed in the right direction. It always starts with a sleep physician because they are the experts. And I work with them very closely to make sure they are treated properly and have an effective result in the end.